11 medical tests to reevaluate after 50. If you're over 50, your doctor has probably been ordering the same medical tests for years. Annual physical, blood work, maybe a cholesterol check. But here's what most doctors won't tell you. Some of those tests you've been getting might not be helping you anymore. And there are other tests you desperately need that nobody's mentioned. I'm a doctor, and I've spent 20 years reviewing medical guidelines. And what I'm about to share might completely change how you approach your health. Last month, a patient came to my office. She's 54, been getting a mammogram every year since she was 40. Turns out, based on the latest medical evidence, she might have been getting screened too often. Meanwhile, she'd never had a bone density test, never been screened for an abdominal aortic aneurysm, and her risk for both was significant. She had no idea these tests existed. By the end of this video, you're going to know exactly which 11 medical tests you need to discuss with your doctor after 50, which ones might be overdone, and which potentially life-saving screenings most people are completely missing. Some of what I'm going to tell you contradicts what you've heard for years. But I'm going to explain the actual medical evidence, not just what's become routine. Because here's the truth. Medicine evolves, guidelines change, and what was standard practice 10 years ago might not be the best approach today. So, if you're over 50, or you have parents over 50, stay with me. This could literally save your life. Let's start with the test everyone thinks they know about: colonoscopy. The standard recommendation is a colonoscopy every 10 years, starting at age 45 or 50, depending on risk factors. But here's what's changing in 2025. If you've had 2 negative colonoscopies 10 years apart with no polyps found, and you have no family history of colon cancer, some guidelines now say you might be able to extend that interval to 15 years or even stop screening after age 75 if your previous screenings were clean. Why? Because the risk-benefit ratio changes as you age. Colonoscopy has risks: perforation, bleeding, complications from sedation. For someone 80 years old with multiple health conditions, those risks might outweigh the benefit, especially if they've had consistently negative screenings. On the flip side, if you've never had a colonoscopy and you're over 50, you absolutely need one. Colon cancer is preventable if we catch polyps before they turn cancerous. But the point is this: screening isn't one size fits all. The conversation with your doctor should include your personal risk factors, your previous screening history, and your overall health status. Don't just automatically schedule a colonoscopy every 10 years without discussing whether it's still the right move for you specifically. Number 2, mammograms. This is controversial, so let me explain carefully. For decades, women were told to start annual mammograms at age 40. Then guidelines shifted to starting at 45 or 50 and doing them every 2 years instead of annually. Why the change? Because large studies found that annual mammograms for women in their 40s led to a lot of false positives, unnecessary biopsies, and overtreatment of cancers that might never have caused problems, without significantly reducing breast cancer deaths compared to starting at 50 and screening every other year. Here's what the current evidence says. If your average risk with no family history, starting mammograms at 50 and doing them every 2 years is reasonable. If you have a family history of breast cancer, especially in a first-degree relative, or if you have dense breast tissue, you might need to start earlier and screen more often, possibly with additional imaging like ultrasound or MRI. The key is understanding your personal risk. And here's what many women over 70 don't realize. At some point, mammograms might not benefit you anymore. If you're 85 with significant dementia or heart disease, the likelihood that a mammogram will extend your life meaningfully is low. These are hard conversations, but they're important. Screening is about balancing benefit versus harm, and that balance changes as we age. Number 3, PSA, testing for prostate cancer in men. This is one of the most debated tests in medicine. For years, doctors routinely checked PSA levels in men over 50. Then studies showed that PSA screening led to overdiagnosis and overtreatment of slow-growing prostate cancers that would never have caused symptoms, resulting in complications like incontinence and erectile dysfunction from treatments that might not have been necessary. Current guidelines say that men between 55 and 69 should have a conversation with their doctor about the pros and cons of PSA screening and make an informed decision. It's not automatically recommended anymore. For men over 70, routine PSA screening is generally not recommended unless there are specific symptoms. But here's the nuance. If you have a strong family history of prostate cancer, if you're African American, which is a higher risk population, or if you have symptoms like difficulty urinating or blood in urine, PSA testing might still be appropriate. The point is that it's no longer a reflexive test. It requires a discussion about your individual situation. Number 4, bone density testing, also called a DEXA scan. This is a test many people over 50 have never had, and they absolutely should. Women should have their first bone density test at age 65. Men should have it at age 70. But if you have risk factors like long-term steroid use, family history of osteoporosis, smoking, heavy alcohol use, or low body weight, you should be screened earlier. Why does this matter? Because osteoporosis is silent until you break a bone, and a hip fracture after 65 can be catastrophic. 20% of people who break a hip die within a year due to complications. Many others lose independence permanently. But osteoporosis is treatable and even preventable if caught early. A DEXA scan takes 10 minutes, is painless, involves minimal radiation, and gives crucial information about your bone health. If your score shows osteopenia or osteoporosis, you and your doctor can start interventions: calcium and vitamin D supplementation, weight-bearing exercise, and if necessary, medications that strengthen bones. I see patients in their 70s who have never had a bone density test, and when we finally do one, they have severe osteoporosis. We could have been treating this for years. Don't skip this test. Number 5, abdominal aortic aneurysm screening, or AAA screening. This is a simple ultrasound of your abdomen that checks for a bulge in your aorta, the main blood vessel that runs through your belly. If an aortic aneurysm ruptures, it's catastrophic, with a 90% mortality rate. But if we find it before it ruptures, we can monitor it or surgically repair it. Who needs this test? All men between 65 and 75 who have ever smoked should have a one-time ultrasound screening. Just once. That's it. If it's negative, you don't need to repeat it. Women who have smoked and have a family history of aneurysms should also consider screening. The problem is that most people have never heard of this test. I ask patients in their 70s if they've had AAA screening, and 90% say no. This is a quick, non-invasive test that can identify a life-threatening condition before it kills you. If you're in that age range and you've smoked, ask your doctor about AAA screening. It should be routine, but it's often forgotten. Number 6, hemoglobin, A1C testing for diabetes. Most people know about fasting blood sugar tests, but hemoglobin A1C is actually a better measure of your average blood sugar over the past 3 months. After 50, your risk of developing type 2 diabetes increases significantly, especially if you're overweight, sedentary, or have a family history. A 1C should be checked every 3 years if you're normal weight with no risk factors. If you're overweight or have prediabetes, it should be checked annually. Here's why this matters. Diabetes damages your blood vessels, your kidneys, your eyes, and your nerves. But if we catch prediabetes early, you can reverse it with lifestyle changes. Weight loss, exercise, and diet modifications can prevent progression to full diabetes. I've had patients reverse prediabetes and avoid a lifetime of medication just by losing 20 pounds and walking 30 minutes a day. But you can't reverse what you don't know about. Get your A1C checked, and if it's elevated, take it seriously. Small changes now can prevent devastating complications later. Number 7. Lipid panel, but with more detail than you're probably getting. Most people get total cholesterol and LDL checked. But after 50, you should also be looking at your triglycerides, HDL, and something called a polypoprotein B, or a coronary calcium score, if you're at intermediate risk for heart disease. Why? Because standard cholesterol numbers don't tell the whole story. You can have normal LDL, but still be at high risk if your particle number is elevated, or if you have calcium buildup in your arteries. Many heart attacks happen in people with normal cholesterol. A coronary calcium score is a CT scan that measures calcification in your heart arteries. A score of 0 means your risk is very low. A high score means you need aggressive treatment. This test isn't for everyone, but if you're 50 to 70 with intermediate risk factors, it can help you and your doctor decide whether you need medications like statins. It provides information that blood tests alone can't give you. Insurance doesn't always cover it, and it costs about $100. But it's worth discussing with your doctor if you're unsure about starting a statin or want more precise risk assessment. Number 8. Eye exams for glaucoma and macular degeneration. After 50, you should have a comprehensive eye exam every 2 to 4 years, and annually after 65. I'm not talking about a vision check for glasses. I'm talking about dilated eye exams, where an ophthalmologist checks for glaucoma, macular degeneration, cataracts, and diabetic retinopathy if you have diabetes. Glaucoma is called the silent thief of sight because it causes no symptoms until you've lost significant vision, and that loss is irreversible. But if caught early with eye pressure checks and visual field testing, it's treatable with eye drops that prevent progression. Macular degeneration is the leading cause of blindness in people over 65. There are treatments now, particularly for the wet form, that can slow or stop vision loss if started early. But you won't know you have it until an eye doctor checks. I've seen people lose vision unnecessarily because they hadn't seen an eye doctor in a decade. Don't let that be you. Number 9. Skin cancer screening. After 50, especially if you had significant sun exposure in your youth, you should have an annual full-body skin exam by a dermatologist. Melanoma is one of the most aggressive cancers, but if caught early as a thin lesion, it's almost 100% curable with simple excision. Caught late, it can be deadly. Basal cell and squamous cell carcinomas are less dangerous, but still require treatment. A dermatologist can identify suspicious moles that you'd never notice yourself. They check places you can't easily see: your back, scalp, between your toes, even under your nails. I had a patient who found melanoma on his upper back during a routine screening. He had no symptoms, didn't even know the mole was there. That screening saved his life. If you've never seen a dermatologist and you're over 50, make an appointment. If you have a personal history of skin cancer or a family history, you need annual exams without question. Number 10. Hearing tests. Most people don't think of hearing loss as a medical issue, but it is, and it has serious consequences. Untreated hearing loss in older adults is linked to cognitive decline, dementia, depression, and social isolation. After 50, you should have your hearing tested every few years, or immediately if you notice changes. If you have hearing loss, hearing aids can make a dramatic difference, not just in your ability to communicate, but in your overall cognitive function and quality of life. The problem is that people wait an average of 7 years from when they first notice hearing loss to when they get help. By that time, the damage to their social life and potentially their brain health has already occurred. Hearing tests are quick, non-invasive, and often covered by insurance. Don't ignore changes in your hearing. Address them early. Number 11. Lung cancer screening with low-dose CT if you're a current or former smoker. If you're between 50 and 80, have a 20-pack-year smoking history, which means 1 pack a day for 20 years, or 2 packs a day for 10 years. And you currently smoke or quit within the last 15 years, you should have annual low-dose CT screening for lung cancer. This is relatively new. For decades, we had no good screening test for lung cancer, and by the time symptoms appeared, it was often too late. Low-dose CT can find small lung cancers when they're still curable with surgery. Studies have shown this screening reduces lung cancer deaths by 20% in high-risk individuals. But most eligible people aren't getting screened because they don't know it's available or their doctor hasn't mentioned it. If you meet the criteria, ask your doctor about lung cancer screening. It could save your life. Let me tie this all together. The medical tests you need after 50 aren't the same ones you needed at 30 or 40, and they're not the same for everyone. Some tests that were routine are now being questioned. Some tests that should be routine are being missed. The key is having informed conversations with your doctor based on your personal risk factors, your family history, your lifestyle, and the latest evidence. Don't just go through the motions of annual checkups, doing the same tests year after year without asking whether they still make sense for you. And don't skip tests that could catch life-threatening conditions early just because nobody mentioned them. Here's what I want you to do. Print out this list or write it down. Bring it to your next doctor's appointment. Go through each test and ask your doctor, do I need this? Should I be getting this? What's my personal risk? Not every test on this list applies to every person, but every person should at least have the conversation. Medicine is not about blindly following protocols. It's about individualizing care based on evidence and your unique situation. You deserve to know why you're getting certain tests and why you might not need others. And if your doctor won't have that conversation with you, find a doctor who will. You are your own best health advocate. Use this information to make informed decisions. Your life after 50 can be your healthiest, most vibrant years, but only if you're proactive about the right screenings at the right times. Take control of your health, ask questions, get the tests that matter, and skip the ones that don't. That's how you live longer and better.